Good afternoon and welcome everyone. Today's live webinar titled CIA Compliance 101 Strategies for Staying Above Board is brought to you by Intrax, the leading contract management solution for healthcare organizations across the country. This live webinar will last 60 minutes. Even though at the conclusion there will be an opportunity for questions and answers, we welcome you to submit your questions during the session in the chat. To do so, please use the Q&A feature at the bottom left of your Zoom window. My name is Stephanie Haywood, and I'm excited to moderate today's webinar with my friends and colleagues, Ritu Cooper and Sarah Lowe. I have nearly 20 years of experience in healthcare contract lifecycle management, helping facilitate the design and development of CLM implementation best practices, focusing on the unique aspects of healthcare organizations. Through this experience, I have been able to help healthcare entities mitigate compliance risk, increase revenues, and enhance efficiencies. I'd like to take a few minutes to introduce our speakers. Sarah Lowe is a certified healthcare compliance professional who brings 19 years of leadership, operational experience, and technology solutions development to the healthcare compliance space. Throughout her career, Sarah has served as an in-house compliance expert for health systems, and over the past several years has largely served as a compliance expert, driving product and operational strategies for SaaS companies. Currently, Sarah is Senior Vice President of Strategy and Operations at Intrax. Intrax is uniquely driven by the experience of dedicated compliance professionals like Sarah and is proud to be strategic partners with Hall Render. Our other speaker, Ritu Cooper, is a shareholder at Hall Render, Killian, Heath, and Lyman. Hall Render is the nation's largest healthcare law firm in the country. Ritu's specific area of practice is fraud and abuse and compliance. She represents providers such as hospitals, health systems, large medical practice groups, as well as pharma and device companies, all in the space of fraud and abuse. Ritu also co-chairs the compliance service line at Hall Render. Day-to-day, Ritu provides counseling to clients on how to be compliant with STARK and AKS. Ritu also helps providers establish compliance programs, conduct internal investigations, respond to government investigations, sometimes resulting in voluntary disclosures. Last but not least, Ritu helps a number of clients manage the requirements under their corporate integrity agreements. So thank you to Sarah and Ritu for sharing their experience with us today on this very important topic. Just to give our audience a little bit of background on the relationship between Intrax and Hall Render. Some of you may be aware that Intrax and Hall Render have been very close partners for a number of years. Actually, Intrax was founded by Hall Render in the 80s when floppy disks were still a thing. Thankfully, technology has evolved, but the partnership between Intrax and Hall Render has continued and remains unique given that we're both healthcare focused. Before we jump into the presentation, our speakers have prepared a couple of questions so that they can gather some information about who's in the audience, as well as so that they can tailor their conversation appropriately. So we're going to take a few minutes to review those now. The first polling question is, what is your role within your organization? Are you a health systems legal counsel? Are you a compliance officer within your health system? Are you practicing in a private law firm, a consultant, other, or are you a vendor? And while we give people a couple of minutes to answer that question, we're going to move to our second polling question.
I think, Stephanie, if it's okay, why don't we just look at this for a second? Because I think once we move to the next one, we might lose the feedback, if that's all right.
Of course. Let's see the results.
I think.
Okay, so it looks like the majority are other or in-house counsel. So I think this is obviously going to be a great conversation for today, although everyone on the call will definitely benefit from it. Okay, let's look at the second question. So in our second question, what has your experience been with CIAs? So you can check all, actually just say single choice. My organization has been through a CIA. My organization has been close to being under a CIA, or is currently negotiating the terms of the CIA, my organization is currently under a CIA or recently completed the term of its CIA, or I have experience with CIAs through my former employment, or CIA, what does the Central Intelligence Agency have to do with healthcare? I can tell you that, as you'll hear through the conversation today with Ritu and Sarah, very little, but you will learn a lot about CIAs. So it will take just a minute to respond to these questions.
I love that we have two people that have selected the last one. So that's good. It means we have a range of individuals that are with us.
Okay.
So
let's look at the results here. My organization has never been through a CIA, so it's pretty even, have experience with the CIA through my former employer. So that is definitely going to be a great conversation today. Hopefully you've never been through one, but if you have, I'm sure you'll be able to have an opportunity to relate to some of the topics today. And in our next question, I'm most interested to learn about the specific details and timelines of a CIA, solutions and best practices to help my organization mitigate the risk of a CIA, examples of real-world CIAs, or practical steps to utilize your CLM to mitigate the risk of a CIA or assist in compliance with the terms of the CIA. And if you're interested in learning about most of these topics or all of them, feel free to select the multiple choice. Okay, let's take a look at the poll. Looks like 62% are, again, it's pretty even. 62% are interested in solutions and best practices to help the organization mitigate the risk. And 60% are interested in examples of real-world CIAs, which we will talk about a bit today. So thank you again for answering the polling questions. And now we're going to dive into the discussion. Sarah, would you like to kick us off with the agenda?
Absolutely. Thank you, Stephanie. And Stephanie and I are in the same room and are working to choreograph our mute and unmuting. So forgive us, forgive us if we overlap in some of that. Again, thank you, Stephanie, and thank you, Ritu, for joining me again, this time to discuss the practical application of some of the requirements underneath corporate integrity agreements. Intrax is, of course, excited to participate in this conversation again with Hall Render to discuss these topics. And not only do we have several employees, as we mentioned in the introduction, that are certified in healthcare compliance, but as many know, our products and services often are designed in collaboration with Hall Render. And that collaboration allows us to provide clients not only operating underneath a CIA with tools, but those who know that utilize requirements under the CIA as best practices, or those that may have be coming out of a CIA, or those just simply wanting to avoid one in general. We're able to provide those tools necessary to maintain compliance. Before we dive deep into the conversation of what a CIA is and some of the best practices surrounding them, let's briefly review the agenda that's up on the screen. We'll start with a high-level overview of what a CIA is, inclusive of what some of the conduct is that can lead to a CIA, the goals within them, some of the common elements. Additionally, we'll work through requirements as they relate specifically to referral source arrangements, which will be predominantly what we're talking about today. Also, we'll talk through a contract management process, risks prior to a CIA. So those risks to a contract management process if there isn't a CLM in place, or if there isn't a policy in place for contract management. And lastly, we'll talk through how CLM, contract management, assists with CIA compliance if you're operating underneath one, or if you're looking just to operate using gold standards, and also mitigation of risks prior to a CIA. At the end, as Stephanie mentioned at the beginning of the conversation, we'll have some Q&A. So please feel free, and I would encourage you to use the chat to enter in some questions, and we will get through as many of those as we can at the end of the presentation. Before we dive into the topics, the other topics on today's call, Ritu, would you mind giving us a high-level overview of CIAs, what they are, and often what they require?
Sure, thanks, Sarah and Stephanie, for inviting me to speak with you guys today and with our audience. Okay, so CIA stands for Corporate Integrity Agreement. A CIA generally is an agreement between the OIG and an entity. Usually an entity enters into a CIA in lieu of the OIG, excluding them from the federal healthcare programs, Medicare, Medicaid, Champus, etc. So there have been times when organizations have resisted entering into a CIA, but we mostly know that if you cannot bill the federal healthcare programs, most healthcare entities cannot survive. So therefore, we do see a lot of people entering into CIAs for a period of time. We've seen them evolve over time. There have been some CIAs in the past that were only a couple of years, but I would say in the last decade or so, we're mainly seeing CIAs with about a 5-year term. And we also are seeing them not just for what we used to think of the egregious bad actors. It really seems like it's just commonplace that if you're entering into an agreement with the government, or you're subject to a False Claims Act suit, and you did not self-disclose, you more likely or not will enter into a CIA. Now, the terms of a CIA track the 7 elements of an effective compliance program. So essentially, it's like a glorified compliance program of what a CIA is. Now, there are some differences between the two, right? When you're doing your own compliance program, there are many things that are voluntary in terms of how you decide to abide by those 7 elements or try to meet those 7 elements. But under a CIA, it's very specific of what the government believes is the appropriate way, or their expectation of you as an organization to meet the 7 elements of an effective compliance program. The CIA also comes with a number of notice requirements and a number of reporting requirements, things that you don't have to do when you are voluntarily putting together your compliance program. And it can be very onerous. There are IROs that have to be engaged, and those are entities that conduct your claims review or your focused arrangements review independently, and you as the organization have to pay for them. Oftentimes organizations hire outside counsel or other consultants to help them with figuring out how to comply with the number of the requirements in the CIA. And then last but not least, there are some CIAs that also require a compliance program effectiveness review that we're starting to see as commonplace. So then there is another consultant that you need to engage as well. There are generally 2 types of CIAs, and sometimes a single CIA can have both aspects to it. One is called a focused arrangement CIA, and the other is a claims review CIA. A focused arrangements CIA is a CIA where generally what got you into trouble was probably some non-compliance with Stark and kickback and arrangements with referral sources. A claims review CIA often is entered into because the subject of your False Claims Act suit might have been something related to billing, medical necessity, or something of the like. We have seen, however, a number of times where the government has put both of them, claims review and focus arrangements requirements in a single CIA, even if the subject of the initial settlement was only one or the other.
Great. Thank you, Ritu, for that great overview of a CIA. Given, though, that our conversation is largely driven surrounding the requirements of a CIA and is beneficial to those that are operating underneath one, as we know from our results of our poll, we had probably, I think the majority that those responded, their organization had never been or was not currently operating underneath a CIA. And some participants may not be familiar at all with a corporate integrity agreement. I think we had 3 asking the question of how the Central Intelligence Agency played a part in this conversation. So given those poll results and the intent of our conversation to be about mitigating risk and being compliant with CIAs, some of you on the call are probably wondering how this applies to you. So Ritu, just to tag on a little bit about what you just said, could you please give us an explanation from your point of view of how this conversation is applicable to a broader audience and not just those operating underneath the CIA?
Sure, Sarah. So whenever we're giving guidance to organizations on how to build an effective compliance program, not only do we look at the OIG guidance for compliance programs, right? The compliance program documents, there's like 11 of them that have been published, all for different aspects of the healthcare industry. We also turn to corporate integrity agreements to look at what might be some of the expectations that the government has of organizations. And when we do that, we are very careful of noting that the CIAs are not minimum requirements. There's been no guidance from the government that says that you must look at the latest CIA or you must look at the CIAs in totality and you must do exactly what the CIA says. In fact, it's exact opposite. The government always talks about how CIAs are very specific to the entity who is entered into the CIA with the OIG. So really, we look at the CIA requirements as the gold standard, maybe something that you're striving for. I think the other way of also looking at CIAs is that CIAs are entered into with entities where the government no longer has trust in that entity, that they can manage their compliance program on their own without oversight. So that makes the restrictions or the requirements a little bit more strict than you would expect in an organization that isn't in trouble. Because I feel like I'm a mom every day after having 3 children. So I usually kind of look at this as how I deal with my kids and if my kids have gotten in trouble and I ground them. More often than not, I tell them no electronics or no TV or anything, any tablet. I have to be very specific, right? I can't just say no switch. I have to say no switch and no PS4 and whatever, no computer, etc. Or limited. You can only do this during the week or only for a couple of hours. It doesn't mean that watching TV or playing on their tablets is bad. But what it might mean is it might show what my expectation is, or what like an indicator of what I think is a reasonable amount of usage if I'm just reducing their usage as opposed to restricting them 100%. And then, the kids are off punishment. And as long as they continue to do their schoolwork and their housework and they're behaving properly, they probably will increase their consumption of TV or they'll increase their electronics use. And I probably won't say anything, right? If they're doing all the other things right. So if we take that same analogy and we look at healthcare organizations and those that are under CIAs, in a CIA, there are a number of restrictions. And one of the easiest ones to talk about is the requirement under a CIA where the compliance officer can't report to, cannot be subordinate, cannot be the general counsel or the CFO. But if we did another poll and we asked individuals what their structure is of their entity, we'd probably encounter a number of organizations that have a structure of their compliance program that falls into one of those categories. Meaning, I know that there are clients I work with where the CCO is also the general counsel. There are a number of organizations where the compliance department reports through the general counsel. There are a number of organizations where the CFO might have responsibility, and the list can go on and on. But really, what we usually say to organizations is we never say you must change it immediately, right? Because CIAs require that. Rather, the guidance we give is that if you choose to do that based on the resources that you have, you would be best served if you try to mitigate that risk as much as possible and put certain safeguards in place. So that as long as the organization doesn't find themselves subject to a False Claims Act suit, and they're maintaining an effective compliance program, no one will likely question the way they choose to structure their compliance program, even though it is opposite to a CIA. Now, of course, that is nothing like what an entity has to do when they're under a CIA, right? So when you're under a CIA, you have to abide by all of the requirements that are within the CIA.
Great, thank you, Ritu. That's really helpful information. and hopefully provides an explanation to those not operating under a CIA why this is a really good discussion to have more broadly across healthcare. Given though that we know most CIAs, or many, I should say, not most, CIAs are a result of alleged violations of Sarkin kickback, are you seeing changes to CIA requirements as they specifically relate to referral source contracting?
Yeah, that's actually a great question. And if you've studied CIAs over time, you see the kind of evolution of the government's expectation of oversight of arrangements with referral sources. So I think early on, when we saw these referral source or focused arrangements, CIAs as the government calls them, we would see just a blanket requirement that you must comply with Stark and Kickback, and this IRO is going to come in and do a focused arrangements review for you. We then started to see the government being very particular about the requirements that organizations needed to put into place related to their arrangements with referral sources, down to really tracking all of the 7 elements of an effective compliance program. So there would be requirements like you must make sure that your arrangement is in writing and signed before services are rendered. Now, that is definitely a question that I've received from clients where they've said, well, hey, wait a minute, we're now in 2023, and we have these relaxations under Stark and Kickback, right? From the final rule that came out a couple of years ago, where we have 90 days to put an arrangement in place, or have it in writing, or 90 days to have a signature. But what do I do under my CIA? Well, the answer is you follow your CIA. And more often than not, you reach out to your OIG monitor. My experience with the monitors that we've dealt with has always been that they will say, no, we expect you to have it in place prior to rendering services and prior to making any payment on those agreements. You're under punishment, right? I mean, so it is a little bit more strict. But anyway, so we've seen the government kind of make those requirements. Also requirements about fair market value, documenting commercial reasonableness, having a certification that you've had an expert in Stark and Kickback, independent of the compliance department, reviewing all of the agreements and making sure that they're compliant with Stark and Kickback before executing them or before commencing them. And we've also seen the government ask for the names and positions of all individuals involved in the negotiation, review, and approval of each arrangement. So this requirement surfaced, oh God, I don't know, 5 or 6 years ago was the first time we ever saw that. Now, after I went to a program an AHLA program in the fall, where an OIG monitor was kind of sharing the latest and greatest with CIAs. And she shared that the Biotronic CIA that was signed in the summer of 2022, so I think it was August, don't quote me, it might be August 23rd or 26th of 2022. The government said that CIA is really the template for all CIAs going forward, and there's probably no room for negotiation with those terms.
That is, I've been trying to get my finger on the mute button. That is really interesting, that you're talking through how the Biotronic is becoming sort of the standard or template as far as CIAs go. And also really interesting how the requirements have evolved from just making sure that there is a review with Stark and any kickback and compliance with it, but also now the government is so interested in requiring the identities of individuals were involved in negotiating. Entities, their roles and their names involved in negotiating, reviewing, approving, and signing. Why is it, that's another first question, why is it that you think they're getting so into the weeds now? And 2, CIAs are negotiable?
Okay, so I'll answer your question one at a time. So for the first one, I think the government's request for this tracking of this information of individuals involved with the contracting process, right? From negotiating and reaching out to these referral sources. And by referral sources, and the reason I'm using referral sources broadly, because in a CIA, it's not just physicians, right? It could be anyone. It could be an arrangement with a medical device company. It could be an arrangement with someone who can order or prescribe services through your entity. So that's why I'm using that term referral source. But I think it really stems from the Yates memo, right? In 2015 or so, we had this Yates memo that was published where the government said, we are very interested in the identity of individual wrongdoers, and we're going to hold individuals accountable. Now, even when the Yates memo was published, the government stated that this is not a new requirement. They've always been interested in identifying bad actors. But the Yates memo kind of put it really front and center, where usually when we see entities negotiating with the government or working through a False Claims Act case with the government, they're asking who's involved with whatever the subject is at the outset, right? So if it's a billing issue, they're asking about who's responsible for any of the coding and billing that's going on, or the education to the physicians of how they document the services provided. And then if we're looking at a focus arrangements CIA, where we're talking about an issue with Stark or kickback, they're asking at the outset, well, who was the leader who was responsible for these agreements that were not in compliance? So I really think that they're trying to put the onus, obviously, back on organizations, but saying, oh, white flag, I don't know who was involved with arrangements. It's just not okay, right? So what they're saying is, we expect you to have tracking of all those that are touching these agreements, so you have a visibility. Now, we all know that before we can call someone a wrongdoer, you need way more evidence than just the fact that they negotiated or they reviewed or approved an agreement, right? So I don't want anyone to think that what we're saying is we're trying to identify wrongdoers. That's not it. We're just trying to say that what the government is requesting, I think, is so that if at some point there comes a question of whether the arrangements are compliant or not, that the organization cannot say, well, I have no idea who was involved. You'd be able to pinpoint it right away of who was involved in that entire process of the negotiation. Now, turning to negotiations of CIAs, yes, there are a number of terms that are negotiable. And so I think one thing that's super important for entities that are at the brink of of entering into a CIA is get to know the OIG counsel who is negotiating the CIA. Send out an alert to your colleagues, go talk to people, find out what that person's pain points are, where they might be a little more agreeable, and what terms they might agree to and negotiate. The other is go back and look at CIAs and compare them to the draft CIA that has been presented to you. I just mentioned that the Biotronic CIA is the one that the government has now said is going to be their template. So certainly look at the Biotronic CIA if you are, subject to entering into a CIA, in the near future. But I wouldn't just stop there. I would also kind of look back at other CIAs, because you never know if there might be some other terms that aren't showing up in the Biotronic CIA or the CIA that you have. Some of the things that are negotiable or that we have been able to negotiate on behalf of our clients. One is who the CIA applies to, or which entities it applies to. So for example, at the outset, more often than not, we see the government proposing for the CIA to apply to the entire, let's say it's a health system that's subject to the issue, to the entire health system. Well, if our False Claims Act suit was only with one entity within the larger health system, I strongly suggest that you try to limit that CIA to just that particular entity. For anyone who's looked at terms of the CIA, I mean, you have to have so much tracking in terms of your training and education and et cetera. And if you're an organization with, let's say, 37,000 employees between your entire system, that's going to be much more onerous to manage than just one entity, and that one entity may have 1,000, right? So if you can limit that, that would be a good thing. The other would be, and I mentioned this a little bit earlier, is the frequency of your compliance program effectiveness review. We're starting to see that as pretty standard as a term. And at the outset, the government usually always says, you need to do this every year. Well, we all know first, it's quite pricey to have to get an external consultant to come and review your program. And in fact, if you talk to external consultants, they'll tell you they don't even think it's best practice to review a program every year, because you really can't see the change in just a year. They usually recommend about every 3 years. So we've been able to negotiate the frequency down from every year to, maybe in year 1 and year 4, for example. So that's another term. If you have a claims review CIA, I would say that the scope of your claims review also is something that can be negotiated. We've seen some where you're looking at 3 different locations, some where it includes just fee-for-service Medicare, Medicaid. We've seen some where, and when I look at those, I think that someone didn't work to negotiate the terms of it, where it's everything, even managed care and Medicare Advantage and all of that are considered as part of the paid claims. And then last but not least are your certifying and sub-certifying employees. For those that are not aware, the government requires that when you submit your annual report after each year of your CIA, you have individuals who certify and state that their entire department is in compliance with every possible law that applies to what they're doing. And so we've seen some CIAs where I've got one client who calls them the Elite 8, where they only have 8 individuals who are certifying employees. I have another client who has 25 or even up to almost 30 individuals who are certifying employees. So those are definitely also terms that can be negotiated. But like I mentioned, the OIG has now stated that the Biotronic CIA is their new kind of template or new form that they're going to be using. So more likely than not, other substantive areas are probably not negotiable.
Great. Thank you, Ritu, for that explanation.
So Sarah, can I flip the questions back to you instead of putting me on the spot?
Yeah.
So being that NTRACS has worked with a number of healthcare entities in implementing a CLMS, and you've worked with a number of entities who are under CIAs, can you share your observations of what NTRACS has seen when working with clients who have not yet implemented a contract management solution?
Absolutely, I can. Like you mentioned, given we've been in the healthcare space for something like 30 years, we've seen quite a bit across the board, and it ranges from simply a head tilting, questioning slightly, to completely jaw dropping. And I'll go ahead and preface this. I have a whole lot of content here to cover, so forgive my long-windedness, but there are quite a few risks and negative consequences of not having some sort of management system in place surrounding contract lifecycle management, particularly around referral sources, but really across the board. We used to see health systems commonly, if they're not using a CLM, commonly using a totally paper process. We still see that. We don't see it as often now, but it still occurs, which is a little bit surprising still. And we see it more often than you would think, given the era of technology that we're in. But we also see a lot of quote unquote management of contracts via Excel spreadsheet. That's probably where we see the most, or maybe just via email, or a local drive, or a shared drive, or some other quote unquote, again, management of contracts outside of a contract lifecycle management system. And so regardless if it's one of those things, it's at high risk of unintended non-compliance. And with non-compliance, as we all know, given the topic of today's conversation, there can be very severe consequences. And those consequences can result in and we see a lot of this with our clients coming to us to engage with us, can occur from something as simple as missing an expiration date on a contract. So they don't realize that the contract has termed. And then because of that, they don't realize that a contract has termed, then they AP is still allowed to cut checks or is still cutting checks on those expired contracts, or HR or payroll to a physician. Oftentimes we'll see organizations either unaware or inadvertently omitting legal and compliance from the review process for contracts. As you mentioned before, there must be an expert knowledgeable for Stark and anti-kickback reviewing these arrangements prior to them becoming executed. So we see a lack of that in an organization's process often. And quite frankly, we see a gap in business review in an organization. So whoever has the business knowledge of a contract sometimes is inadvertently omitted. And beyond that, it gets extremely difficult to get a clear picture of a contracting world within an entity or healthcare organization globally without having some sort of centralized contracting management. So not only does a contract management system help to approve process and making sure certain checks and balances are occurring, but it also will ensure that data is entered consistently, it's entered at all, one, and that it's entered consistently, and therefore it makes it easily reportable. I think I can safely say that many in our audience are well aware of anxiety that can happen and does occur when somebody or an auditor from the OIG or DNV or a joint commission shows up on site, either announced or unannounced, asking for a comprehensive list of contracts or a subset of them, and there just isn't the capacity to pull that data easily. So we get phone calls, our help desk or support team gets phone calls often for those clients where those auditors have come on site asking for our help. So the risks can go on and on if there isn't a CLM in place. Beyond that, beyond just being absent of a CLM, we also see organizations coming to us that don't have a very well documented, organized, and then adopted contracting policy. Usually they'll have something in place that will outline what the request process is, like who can request a contract or how one can be made, and maybe also who needs to approve it at a high level from a role. But there typically is not, or often is not, a consistent process for the type of data that must be collected along with the requests for all types of contracts, but specifically for referral source arrangements that we're talking about today, which are extremely high risk. When I'm talking about data, and I'll spend some time talking about that, you've mentioned on a couple already, it's documentation that fair market valuation has occurred. Not necessarily housing the fair market value inside of your CLM, but you do need to document that it's occurred. Maybe documenting that it's occurred internally because it's permitted conditionally in some situations, or that fair market value has occurred externally if that's required in some situations, or simply when a BAA is required. And also the process should document who within the organization is charged with making sure that those things have been gathered and gathered accurately. A single missing BAA, I talked about those costly consequences, and this is one of them. One missing BAA on one singular contract can result in tens of thousands of dollars in fines from the government. So this can multiply quite quickly, as you all are aware, if you don't have the appropriate safeguards in place, which we unfortunately see often. And then lastly, before I turn it back over to you, I'll mention, without a well thought out contracting protocol, there's often not training and education surrounding risks, much less than there being control over contracting. You mentioned a training and education requirement surrounding compliance. That should go hand in hand with contract management. Also, without a centralized process, there can be a broad group of people within a health system that are able to request contracts, and an inconsistent requirement for who's able to approve them. That inherently is high risk all over it if you've got people across the board able to request contracts, but it also can lead to quite costly business practices. And I'll give you a real life example. I used to work inside of a health system and was charged with managing a contract management process from the inception or request of a contract all the way through managing the terms of it. And all that this was during a CIA and also post CIA, coming out of a CIA. And although I'll say with bias that I think our process was really well thought out and we had our I's dotted and T's crossed, we were not great at controlling it and enforcing it and educating surrounding it. So a consequence of that was we would have nurses and physicians on the floor, not intentionally, unintentionally though, engaging with contracts with vendors that approach them on the floor, and then making our health system obligated underneath those contracts they'd entered into, and legal and compliance had no idea they even existed. So looking back on that now, it's frightening, but I think it largely happens more than we probably think.
That's great, Sarah, and thank you, you and Ritu, for this thoughtful discussion. I think now would be a really good time for a couple of questions. So we have 2 more polling questions to go through. So let's just take a look at those. The first is, how is your organization currently handling contract management, given what you just talked about, Sarah? And Ritu, obviously it's important to do so. So if our attendees could take a minute to answer these multiple choice questions. All of our contracts are stored manually on paper in a file cabinet. All of our contracts are stored electronically in a shared folder and or network drive. They are all stored in a contract management system. They are stored in a contract management system and you manually approve them, which I think we see with organizations, or all of your contracts are stored in a contract management system and we electronically approve them. And while we are answering that polling question, we actually did have a question come in through the chat. Ritu, you mentioned the CIA that was identified as a template. If you could just mention that name again.
Sure, it's Biotronic, BIOTRO.
Oh, Ritu, I think you might be on mute.
Nope, I've unmuted myself. Can you hear me? Yeah, I'm not on mute. Can you
Can't hear you, Ritu, but it is Biotronic, I believe,
Oh.
is the name of that CIA.
So weird. Okay, well, I have people saying that they can hear me. So anyway,
Okay.
so it's
Ritu can be here.
So it's Biotronic. If someone from HLA will let me know if I escape so I can grab the link. Will I jack up? Will I screw up this recording?
Yes, please don't leave.
Great. Thank you.
Okay,
Ritu.
well,
And
then I
we'll go ahead.
won't press escape. But anyway, so what I'll do is at the very end of this, if we have 1 minute, I'll try to grab that link and I'll put it in the chat so people can have it. But it's Biotronic. It was August of 2022, and it was maybe like, I don't know, the 23rd or 22nd or 26th, something like that.
Great. Thank you.
Oh,
Okay,
so
thank you,
someone
Ritu. I think we're having a couple of technical
Angela.
difficulties. We're going to go ahead and look at the polling question.
So Angela, thank you for putting that,
Perfect.
in the chat.
So looks as though all the majority contracts are stored in a contract management system, and they are being electronically reviewed, as well as all of the contracts are stored in a shared folder. So a pretty even split. We'll look at our second polling question. Does your organization have a documented contract policy or SOP? So we'll take just a second to answer that question. Okay, and we'll go ahead and take a look at the polling results.
Stephanie, I'd wait a minute, so don't end it because only 30 people responded. So Kristen, if you can reopen that up for anyone who wants to continue to respond.
Just a second to look at the polling results. And I think, Sarah, you can speak to, again, most organizations do have a contracting policy, but it's the adherence to that policy and ensuring that it's followed.
So Sarah, I think people are still responding.
And we'll look at the results of that in just a minute. Sarah, do you want to, let's go ahead and continue on. Oh, Ritu.
So it seems that Stephanie can't hear me, but I think people are still responding, Sarah. So if you can hear me, we'll just wait a couple minutes because only 27 people have responded so far, and we have 72 on the call?
Thank you. And I can hear you, Ritu. Thank you.
Okay, perfect. All right, so we'll just maybe give a couple more seconds. But one comment I'd like to make while people are doing that, I am stoked that no one has put on here that their contracts are stored in paper in a file. Now, I don't know if people are shy about responding to that, because that has not been my experience, because a lot of the entities I work with still have that process, but
Absolutely.
I'm still excited that there were 0 for that. So, and if you do fall into that category, there is no shame. We're all learning and we're all trying to get to the next stage. So I don't know, Sarah, what your experience has been. Are you dealing with a lot that are going from 0 to nothing, or going from a kind of something electronic?
No, we used to see it quite a bit, Ritu. We saw almost all were paper process in the past, and that has since evolved. And we just got the polling results in. I'll just pause here so we can review them since they're on the screen. It looks like the majority of folks that are on the call do have a contracting policy or SOP, which is great news. There are 11% that do not have one, and there are 31% that are not sure. So that speaks a lot to some of what we're talking about today, and the importance of a well trained and organized and rolled out contracting process. But to answer your question, absolutely, we have seen a ton in the past of people with paper. We're seeing a lot less of that now. That's a little bit smaller of a situation that we run into now. It's more shared drives or spreadsheets like we talked about before.
Perfect. Okay, before we go to the next question that I have for you, Sarah, if Stephanie can advance the slide to the very next slide, because I think that's really we keep it right here. Okay, so Sarah, what I would love to know is, we have, and we now have an example of some of the requirements that we're seeing in the CIAs of the types of things the government expects entities under CIAs to be tracking. And so I would love if you could talk a little bit about some of the adjustments that healthcare organizations can make to their current contracting process so that they can be more proactive. And also, just even if they're, we did have a certain percentage, I think it was like 16% or so that are under a CIA, of how they can maintain compliance under their CIA.
Absolutely. So similarly, like I mentioned before, there's a lot of ground to cover here and some opportunities to improve with a contract process, and also how you're managing data. So I have a lot to cover, so I'll say forgive me in advance for being long-winded. But as you mentioned, Ritu, just tagging on to what you were saying, we all can agree, whether Biotronic now is we know is the standard, but we can probably all agree even before that a lot of the requirements laid out on a CIA are generally accepted as a best practice or a golden rule to live by, even if you're not operating underneath one or haven't before. So not only that, so contracting teams should be relatively familiar with the requirements that we're reviewing today at some level. Again, even if your organization is not currently operating underneath a CIA or is not coming out of one, you should be relatively familiar with the requirements that are now coming out as standard. Intrax certainly is able to guide in that direction if that's something that your organization is not familiar with, if you're engaged with us. But I'll begin with talking through some of the opportunities for improvement in contracting processes, beginning first with that contracting protocol or policy. We saw in the last result that there was some percentage, I think it was like 11% or maybe more, that were not familiar with the existence of a contracting protocol or process, which speaks a lot to some opportunity to for mitigation of compliance risks. So there should be not only a well thought out and thorough contracting policy, but it should absolutely be well adopted and well educated. And we'll talk a little bit about that in just a second. But within that contracting policy, though, there should be, or protocol, there should be very specific things laid out within it. And minimally, it should include, and again, these are all things that we've alluded to before, It should include who within an organization is permitted to request a contract, which we suggest should be a relatively narrow and well-trained pool of people that should mirror your organizational structure. Meaning, if you operate with a service line structure, maybe you've got individuals within your service line that are educated about your contracting policy, or service lines that are educated on contracting processes that are permitted to request contracts. Or if you have a top-down organizational structure, maybe you've got all contract requests must funnel through legal at a corporate structure. Or maybe you've got a contract administration team. Regardless, whomever is permitted to request those contracts should be well trained on the process as a whole, and also the whys of the whats they're being required to do. So they should know why they're being asked to do what they're being asked to do. There should also be a well laid out requirement as far as documentation of data and supporting documentation for all types of contracts, but again, particularly as we're discussing referral source arrangements. Beyond that, who signs off on the data? That should be laid out in your contracting process. Who signs off on the supporting documentation? Who's required to gather it? Who is responsible for maintaining boilerplate language and templates? Where are those templates able to be accessed? What template is required for what type of contract? Who has the authority to negotiate the terms within an agreement? Is there someone in particular permitted within each referral source type of contract? Maybe for physician employment agreements might be different from medical directorship agreements. That should all be very well laid out within your policy. And then lastly, as far as what's documented in your policy, once the contracted, and I did mention signature and approval, that all is a given that should be documented very clearly inside of your contract process. But once that contract is fully executed, you're not finished. And I think that there is a misunderstanding that it is at that point, and it's not. There also needs to be specific requirements documented for how your contracts are monitored. Who's monitoring the performance, who's accountable for monitoring it, what types of data needs to be re-reviewed, like fair market valuation needs to be re-reviewed quite frequently, the quality of performance, et cetera. So once there is that well-defined and thorough contracting process, there should also be a well-managed CLM with a well-designed feature set, preferably with healthcare in mind, wrapped around it to help you manage that process, since there's so many things that need to be considered. Also, I'll mention just briefly that, and I talked a little bit about it in your requisition process, but the CLM should be organized in a way that also mirrors your organizational structure. So in a way that not only helps with reporting, but also provides better access to security surrounding your focused arrangements, and what decisions were made surrounding the approval and re-review of those contracts, et cetera. That should all be really secure. If there's already a CLM in place, this is a relatively easy thing to implement. If not, that's going to be a larger lift. And then I'll mention the last thing, the data tracked at a minimum on fully executed contracts should be your effective and expiration dates, so that you're tracking and avoiding missing expiring contracts. Auto renewal dates, so those auto renewal terms need to be tracked. Your term language needs to be easily reportable, any out clauses, et cetera. Who the signatories were, and also any other critical tasks and reminders like your fair market value review and quality evaluations like we talked about before. This helps ensure that you're not missing any major milestones associated with your contracts, which we all know can have real significant risks. And then I lied, I do have one additional point to make before I turn it back over to you, Ritu. It's also really important to have data tracked in a way that can facilitate ease of reporting. You mentioned IRO earlier, and there are specific reporting requirements surrounding an IRO, and also compliance requirements to audit your contracting process. Without appropriate data tracked and a way to report on it, that becomes a very difficult task to accomplish.
So I see that we've just been given the 5-minute mark. So
I know.
I do have another question for you, Sarah, but I'm thinking that why don't we open it up to questions and see if anyone has any questions? And if there's no questions, then I'll ask you another question. And if there are questions, then we can at least answer some of those. So if anyone has any questions, feel free to put them in the chat or in the question and answer section of the Zoom. And if in the next like 30 seconds or so we don't see any, then Sarah, I'll ask you one more. All right, so.
Okay, so I think we do have just one question that we wanted to ask. At the beginning of the presentation, Ritu, you and Sarah stated that CIAs are not the minimum standard, but rather what the government expects organizations that it doesn't trust. This individual has been in healthcare for over 20 years, and they have never been in an organization that's under a CIA or even broaching a CIA. Do they really need to have a CLM that tracks the name and position of all the people that are involved in reviewing and negotiating and approving the contract?
Sure, I think that's a good question, Stephanie. You probably don't have to, right? Again, the CIA is what we said is a gold standard, not the minimum standards. So you don't necessarily have to track that information, but I think it's probably in your best interest because you don't know. Remember with False Claims Act suits, I mean, they could file something 6 years from now that relates to activity today. And if in 6 years they're asking you about a certain set of contracts, and if you don't have any visibility of the individuals or the position that they had at the time, then you won't be able to point a finger if there is a finger to point, that being said. So I would say if you have a CLM with the ability to be able to track, and like Sarah was mentioning, limiting the number of people who can negotiate contracts, who can initiate them, who can approve them, and those who can execute them, I think you'll be better for it. I see that there is another question in here that says, any best practices on how to capture and report reportable events under CIAs? I think that is a great question. So for those that are not familiar with reportable events, under CIAs, there are a number of triggers that you then have to report to the government. So for example, there might be one trigger, which is a change in the structure of your board composition. And you have to report that within, I think it's like 15 days. There might be another where if there has been a change in your certifying employees or something, there could be a number. And then on top of that, there are also reportable events where you need to report if there has been a change in the structure of the organizations, meaning if you are acquired or if you're selling part of your entity, because the CIA, the de facto is that it travels to the entity that is acquired or a part of the entity that you've let go of. Unless you notify the OIG of why it shouldn't. And then there are reportable events when you might have done a review and you've noticed that there is a substantial overpayment. Now, one thing the government has not required is giving a definition of what a substantial overpayment is. They turn to the organizations and they say, you define that and then let us know. So that's what reportable events are. I don't think your CLM is the place to track your reportable events. I've got a number of clients that have like a share file site or something where they keep the different requirements. So they have the board, roster listed. And then when there is a change in the board composition, they then have something, and I'm not a tech person, but they have something that pings that says, okay, this is the date that this person has now joined the board. Now you have 10 days or 15 days to report. So I would definitely not do it in your CLM because it's not a contract.
Great. Thank you, Ritu. And I think that just about wraps up our time. I know we have a lot of great conversation. You will receive copy of the deck. I want to thank everyone for joining us. Again, I want to thank Sarah and Ritu. If you'd like to listen to more conversations with Sarah, Ritu, we're fortunate that they speak together quite often. So please feel free to check out the webinars that they've given over the past few years on demand at www.intrax.com. Thank you again, everyone, for joining us, and have a great afternoon.
Thanks so much.